Welcome. This animated short covers the classification and the mechanism of action of antiarrhythmic drugs. Antiarrhythmic drugs correct disturbances in the formation and conduction of the cardiac action potential. The action potential has 5 phases. Phase 4 is the resting potential. Phase 0 is rapid depolarization, driven by sodium influx. Phase 1 is early repolarization. Phase 2, the plateau, is sustained by calcium. And Phase 3 is repolarization, driven by potassium efflux. Most antiarrhythmic drugs act by modifying these ion currents. These drugs are classified by the Vaughan-Williams system, which is based on their mechanism of action. Class 1. Sodium channel blockers, divided into subclasses A, B, and C. Class 2. Beta-adrenoceptor blockers. Class 3. Potassium channel blockers. Class 4. Calcium channel blockers, plus a miscellaneous group, including adenosine, digoxin, isoprenolone, and atropine. Class 1 drugs. The membrane-stabilizing agents block sodium channels. Class 1A shows moderate sodium block and prolongs the action potential. Examples are quinidine, procainamide, and disopyramide. Class 1B shows mild block and shortens the action potential. Lidocaine and mexiletine. Class 1C shows strong sodium block. Flecainide and propafenone. Mechanism of action. Class 1 drugs bind to sodium channels during phase 0 and slow the rate of depolarization. This reduces conduction velocity and prolongs the effective refractory period, abolishing re-entrant arrhythmias. Class 1A also blocks potassium, prolonging the action potential duration. Class 1B shortens it and prefers ischemic ventricular tissue. They also raise the threshold potential and depress the automaticity of ectopic pacemakers. Class 2. The beta blockers. Propranolol, metoprolol, esmolol, and sotalol. They block beta-adrenergic receptors on the sinoatrial and atrioventricular nodes, suppressing ectopic pacemaker activity that is driven by sympathetic stimulation. They are considered among the safest of the antiarrhythmic drugs. Class 3. Potassium channel blockers. Amiodarone is the prototypical broad-spectrum agent. It blocks myocardial potassium channels, prolonging phase 3 repolarization. This increases the action potential duration and effective refractory period, seen as a prolonged QT interval. Amiodarone also shows weak class 1, 2, and 4 activity. Class 4. Calcium channel blockers. Verapamil and diltiazem. They block the slow calcium channels in the sinoatrial and atrioventricular nodes, slowing conduction and prolonging the refractory period. They are especially useful for supraventricular tachycardias. In summary, Class 1 blocks sodium. Class 2 blocks beta receptors. Class 3 blocks potassium. And Class 4 blocks calcium. Each class corrects an arrhythmia by tuning a specific ion current of the cardiac action potential. Thank you for watching.